Hi Lorraine, I'm here with Andrew again, and after we performed his overhead squat assessment, I noticed that he had a hip shift to the right, and that would indicate that he would have overactive adductor complex in the left side, which would, as he squats down, it would bring him into that way because it's so tight. So the first thing that we're going to do is we're going to foam roll the adductor complex on the left side. So to do this, self-myofascial release, and have Andrew lie with the foam roller in front of him like this. He's going to lie down, face first, with the inside of his leg on the foam roller, and lean onto his arms like this. And he's just going to roll around and try to find a tender spot or an adhesion, and then he'll stay on the adhesion for 30 seconds. So Andrew, if I could just have you lie down, face forward. Just like that. And if you could straighten your leg a little bit. So just like that. And roll until you find an adhesion. And we're going to hold that for 30 seconds. Good job. Okay, Andrew. Now we're going to static stretch the adductor complex. So if I can have you stand up, please. Okay. So what I want you to do is you're going to take, since we're stretching the left side, you're going to put your right foot about half a foot in front of the right, in front of the left, and now take a step to the side so that your feet are as wide as you can go, your legs are as wide as you can go, with your right foot still a half step in front of the left. Awesome. Now I'm going to have you put your left arm, put your left hand right on top of the hip joint right there, if you can feel the top of your femur right in there. And so as you push down, I want you to push right on that, pushing the joint straight down, pushing the joint capsule down. We're going to hold that for 30 seconds. Yeah. You want to keep that leg extended. Perfect. We'll hold that for 30 seconds. Great job, Andrew. Now we're going to do PNF, which is proprioceptive neuromuscular facilitation stretching. So I'm just going to have you lie flat on your back, please. Okay, great. Now I'm going to just take your leg out like this until I feel a stretch. It's about right there. So when I do this, I want you to try to focus on pulling your leg in for about 2 seconds. 1, 2, okay. We'll do that again. We'll do that again. Great. So we want to do that for 1 set of 10 for 2 repetitions, or 2 second hold, sorry. Okay, Andrew, if you can stand up, please. The next thing we're going to focus on is on the right side, you had an overactive bicep femoris, and that also caused the hip shift to bring you in like this. So the first thing we're going to do with that is we're going to SMR, self-myofascial release, the bicep femoris. And Andrew, just so you know, the bicep femoris is one of the hamstring muscles, and it's the most superficial one, and it's on the outside of the leg, just right here. So that's what we're going to try to focus on when we roll it. So have you sit on the roller, and to increase the pressure, I'll have you fold the other leg over top, and then we're going to just roll a little bit to the outside, and we'll try to find the adhesion. Hold that for 30 seconds on the adhesion. So Andrew, I just want you to be a little bit more straight, so if you could roll back to the left. So actually, just put your left arm right back on the ground. because the more you roll onto the right, then we're going to get onto the TFL and IT band, so we want to still be on the hamstring. We'll hold that for 30 seconds. Great job. Okay, next Andrew, we're going to static stretch the bicep femoris. So to do that, you're going to, so I'll demonstrate. So we're going to lie flat on the back. You're going to bring your knee up like this, and then put the opposite, or bring the whole leg extended, and bring the opposite arm across, and you're just going to pull lightly into the opposite shoulder. You should feel it stretching through here. Good job, just like that. And hold that for 30 seconds. Great job, Andrew. Now finally we're going to do the PNF stretch for this. So if you can just stay in that position. I'm going to lift your leg into a 90-degree position, just like that. I'm going to slightly adduct it. Now, I want you to contract the quad muscle and straighten the leg. Hold that for 2 seconds. Another release. And contract the quad. Good job. So for that, we'll do 1 set of 10 with a 2-second hold at the top.